Assalamu alaikum. This article talks about the effect of calcium hydroxide paste in different vehicles on bacterial relation during treatment of teeth with apical periodontitis. This article done by Isabela N and her group in 2023. The premise of this article that the residual bacteria comprise an important risk factor for post-treatment apical periodontitis. So the need to supplement disinfection of the root canal system after preparation become clear. So the sodium hypochlorite used in chemomechanical procedures, the retention time of these sodium hypochlorite in the canal is not sufficient to render most canals bacteria-free. So the intra-appointment in the intracanal medications remain in the root canal for days rather than minutes. The possibility exists that it will have sufficient time to diffuse and reach the bacteria that survived the chemomechanical procedure. So the aim of this study, or the questions, it is what is the clinical antibacterial effectiveness of endodontic treatment using different calcium hydroxide paste in glycerin and converted paramonochlorophenol, and with glycerin also, or chlorhexidine as intra-appointment medication in infected canal of teeth with primary apical periodontitis. In this study that want to evaluate the bacteria presence and their total account before and after instrumentation and after medication, evaluated by quantitative real-time PCR assay. Regarding to the methodology, they select 90 patients over a period of 3 years, and all teeth had a single root and single canal with the evidence of asymptomatic apical periodontitis. The primary outcome to be evaluated in this study was the bacterial reduction after root canal instrumentation and medication with the 3 different calcium hydroxide paste. And these teeth are randomly distributed in 3 groups, which is the first group, it is the calcium hydroxide paste in glycerin. The second group is calcium hydroxide paste in camphorated paramonochlorophenol and glycerin. The third group is calcium hydroxide paste in 2% chlorhexidine glyconate solution. The first sample was taken by paper point before the initial root canal preparation, and the second sample taken after root canal preparation, and the third sample taken in the second visit after dressing for 7 days of these intracanal medicaments, and the root canal preparation done with a single reciprocal instrument using 2.5 sodium hypochlorite, and the final rinse was 17% of EDTA, including 5 ml, followed by 5 ml also with sodium hypochlorite 2.5%. Then after 7 days, as I mentioned, they taking the third sample with a paper point as a post-medication sample. Then they will assess the total bacterial count before and after chemomechanical preparation after intracanal medicament using 16S ribosomal RNA gene-based quantified PCR assay. In the result, they find in the first group 69% of cases still had detectable bacteria in the second sample, and it reduced to 59% in the third sample. In the second group, they find 59 of cases had positive for bacteria in the second sample and reduced to 52 in the third sample. The third group, they find 70% of cases in the second sample have still positive for bacterial presence, and it reduced to 57% in the third samples. Intergroup comparison show no significant difference when comparing the 3 samples for bacteria count and the number of bacteria positive cases. So this study showed the conversion between 3 pastes show no significant difference in bacteria counts and the number of bacteria positive cases. The ability to supplement disinfection after chemomechanical preparation was also evaluated, and of the paste tested, only the second group, which have comparated chloromonophenol and glycerin show a statistically significant additional reduction in bacterial counts. So the limitation of this study and most clinical study with the conventional sample taken approach using a paper point, which can only detect bacteria present in the main root canal, lumen, and its immediate venicity, and also the limitation of the cultures study that had demonstrated that 20 to 7% have still detectable bacteria after chemomechanical preparation with the sodium hypochlorite. This result may have a positive influence on the treatment outcome. And thank you.